Hello everyone. Today, we're exploring the medication Qualaquin, known generically as quinine sulfate. As always, this discussion is for educational purposes only. If you have health-related questions or concerns, it's important to consult with a healthcare professional. Description: Qualaquin, with the active ingredient quinine sulfate, is an oral medication primarily used to treat malaria. Malaria is a disease caused by parasites that typically enter the body through the bite of a mosquito. Quinine belongs to a class of drugs known as antimalarials. It works by killing malaria parasites, preventing them from multiplying in red blood cells, which stops the infection from spreading. Qualaquin is available in capsule form and should be taken with food to reduce stomach upset. Warnings: Quinine can cause serious side effects on the heart, blood cells, and other parts of the body. It is important to use Qualaquin for the treatment of malaria as prescribed by a doctor. It is not approved for use by anyone younger than 18 years old. Quinine should not be used to treat conditions other than malaria, like leg cramps, due to the risk of severe side effects. Before taking this medicine. Before starting Qualaquin, inform your healthcare provider if you have heart disease or a heart rhythm disorder, low potassium or magnesium levels in your blood, glucose 6-phosphate dehydrogenase, G6PD, deficiency, myasthenia gravis, optic neuritis, or if you have had an allergic reaction to quinine in the past. It's also crucial to mention if you are pregnant or breastfeeding, as quinine can harm an unborn baby and may pass into breast milk. Side effects: Qualaquin can cause serious side effects, including changes in vision or hearing, severe bleeding, electrolyte imbalances, and signs of an allergic reaction. Common side effects may include headache, blurred vision, changes in color vision, sweating or flushing, nausea, diarrhea, stomach cramps, and vomiting. If you experience any severe or persistent side effects, contact your healthcare provider immediately. Interactions: Quinine can interact with other medications, which can increase the risk of side effects or reduce the effectiveness of either drug. Inform your doctor about all other medications you use, including prescription and over-the-counter medicines, vitamins, and herbal products. Dosage: The dosage of Qualaquin must be carefully followed as prescribed by your healthcare provider. The typical adult dose for malaria is 2 capsules every 8 hours for 7 days. Always take Qualaquin with food, and do not skip doses as it can increase the risk of further infection that is resistant to antimalarial medication. Avoid: While taking Qualaquin, avoid taking antacids or dairy products within 2 hours before or after you take quinine. These can make it harder for your body to absorb the medication. Also, avoid taking other antimalaria medications unless your doctor has told you to. FAQ: People often ask if Qualaquin can be used for leg cramps. It's important to note that the FDA has warned against the use of quinine for nocturnal leg cramps due to the risk of serious side effects. Closing: That concludes our session on Qualaquin. Remember, this information is for educational purposes and is not a substitute for professional medical advice. Always consult with a healthcare provider for any questions or concerns about your medications. Thank you for joining us.